Corla, and I just too want to welcome the motion and thank Deputy Joan Collins for bringing it. And I welcome the positive amendments from Fianna Fáil and from Sinn Féin, and I think they're helpful. And Minister, I want to say it's a very good strategy. I couldn't find fault with it, but like the vision for change, it remains a strategy. It's the implementation of the strategy that's the problem. And one couldn't improve on what's in it, and indeed it builds on two previous strategies, and this one is more health-focused and more person-centred, which is welcome, and it follows on from two previous ones before that, the last one that finished in 16. And so the strategy is not the problem, it's the implementation of it. And because, just like with Vision for Change at the time they set up, because nobody trusted any government, a separate independent monitoring mechanism was set up for Vision for Change. It's set for 2-3 year periods. It was wonderful. It gave the positive and it gave the negative. It showed the improvement and what didn't. And then, I don't know which government, I've lost track of it, abolished it. And so, similarly here we have a wonderful strategy. And the strategy, of course, is born out of pain and death. And it has come from the response of the communities who have fought on the ground and been ignored by government after government. That's where this strategy came from. And it's unfortunate then that the actual shorter term plan with 50 actions, and they were to be completed, I understand, Minister, by next year, 2020. Are you in a position to tell us how many of those 50 actions have actually been implemented? Because I would have expected that at the very least in your response today. I mean, we're responding to frustration from groups on the ground at the lack of implementation. And that's why I mentioned Vision for Change, because it's déjà vu. And of course, the two strategies, and the vision and the strategy, are completely, as to say, in Gaeilge, fitche fuche le céile. They're totally tied up with each other. We don't need any more strategies. We don't need any more plans. We need action, and we need commitment, and we need a minister coming in saying, look, they're the 50 actions, we've dealt with 20, 30 of them, and we're going to have the other 20 done within the time or not. That's the sort of just straight talking we need in relation to this. And I agree with Deputy Gino Kelly when he says we need an honest conversation in relation to the decriminalisation of certain drugs. And we need a very honest conversation in relation to alcohol. It is a major problem in Galway City. The level of suicide in Galway, I would find it too upsetting to go into the actual number of deaths per week in Galway of people going into the water. And of course it is tied up with lots of things. It's tied up with mental health, it's tied up with the abuse of alcohol, and they are tied up with the abuse of drugs. It's also tied up with our hypocrisy. For instance, again in Galway, we fought, the guards told us that they couldn't prevent drinking in the street. This is a very practical example now. And so we brought in bylaws, and there was a fault in the bylaws, and a second lot of bylaws were brought in, and the guards said they couldn't act until the councillors brought them in, so we did, and we brought them in, and it's now an offence under the bylaws to drink on the street. But of course, different interests decided, well, we should be able to drink on a certain street and not other streets. And so that's one problem. And the second problem is the guards say they don't have the staff to implement the bylaws. So that level of hypocrisy is very apparent to the people who drink and drink to excess. They see our hypocrisy. They see it in relation to our advertising. They see it in the way that we promote sport through alcohol. And so that's something that we really need to face on a serious level. You'll have my full support if you start doing that, ministers, in relation to this. But the first beginning has to say, where are the 50 actions? How many have been implemented? If they haven't, why haven't they? There's problems, I understand, with governance on the ground. And again, we face this every single Thursday in the public accounts. Governance, and more governance issues. And we see a chairperson saying openly in the paper that he stayed on for a longer period of time, even though the recommended time was 3 years, because nobody else was there to take his job. Now, I don't think that's acceptable, but there should be a feedback mechanism where there's a shortage of a chairperson, a shortage of a coordinator, because they simply cannot function on the ground without that type of backup. So that's as much as I got. Go and Rochjog.